There's no microphone to look at. There's no computers to look at. This picks it all up.
Okay, well, welcome everyone. So the September 21st meeting of the Nantucket Board of Health is now in session. Just as a note, I have a hard endpoint of 6 p.m. So we wander on, but I don't think we need to set a record like the planning board that went, what, six hours the other night? 6.5 hours. So I think 2 hours is enough. As regard to agenda, if my fellow board members don't have any objection, the discussion on the fire department cancer report, the chief is going to try to be here, but he has a conflicting meeting. And so whenever he comes in, I wouldn't mind if we did that agenda item next for his convenience. And if there's no objection, since I may or may not be here, I would love to hear about item 16 first, if there's no objection.
That's good.
Okay, so a public announcement. This meeting is being recorded, audio and visually. Is there any public comment on any item not on this agenda?
Can I make a quick comment?
Absolutely.
Discussion I've had with other people is for septic systems and having to update to IA systems. When you go to the Department of Environmental Protection Massachusetts page, there's 5 pages of systems. Is the town or us or someone looking at some of the other alternatives to what is normally being installed? And I'm looking at the prices coming through on these things, and it's just, are there other ways to achieve what we want to get using other IA approved systems? And is there any research either with UMass or anyone where that could be explored? Because it's just an escalating price and a need that we have to address.
Yes, no, absolutely. The IA system list is handled by the State Department of Environmental Protection. In order to be approved, part of the approved IA system list, they have to go through the MassTC, the Massachusetts Septic System Testing Center, outside of Falmouth. So that once it gets passed through the MassTC, then DEP will vote in. Their council votes in the IA system into an approved list. As far as the health department is concerned, as long as it's an IA system with nitrogen reducing technology, we'll allow it. We have a few here that are in the pilot testing right now, which I believe the nitrix system is one of them, which uses wood chips as nitrogen reduction. The difference between nitrix and your typical aerobic digestion one is that it takes a lot more space, but it is an approved type.
Okay.
But yeah, anything that's under nutrient reduction in the list is acceptable on the island here.
Okay.
Do the people that need these systems have access to these different types? Because some of the prices in here are mind-boggling.
Absolutely. It is technically up to their engineer or surveyor. We don't usually interact with the property owner.
Yeah.
We usually interact with the engineer when they come into our office.
Okay.
They go to the same trainings we do, so I assume that they have the same list that we do.
Okay.
So I guess we just encourage citizens to just ask the right questions to their engineers.
And make sure and have the engineers be just aware that there's more options.
There's many options. Okay, thank you.
Thank you.
I have one quick comment.
Yes, please.
The Run for Recovery is on Sunday
Yes.
Okay,
to benefit Addiction Solutions of Nantucket.
I have to work Saturday. All right. I'll be there in spirit.
It's Sunday.
Okay,
It's a 2-mile walk or a 5K run.
it'll be a walk. All right, thank you. Okay, any more public comment? Approval of minutes. My only comment, whoever's taking the minutes, my last name is spelled Macnab.
I'll let.
That is
Kathy know.
presently spelled the way Donovan McNabb, the football player, spelled McNabb. But I am not Donovan McNabb, I'm Malcolm McNabb, MACNAB.
Okay, I'll let Kathy know.
Right. First update of Summer House. We had asked for an update in September on how
Yes.
Summer House was doing.
So we put in the summary in the packet. All in all, everything worked out pretty well. There are some issues that we do need to work out before the opening of next season. But I feel that Sean's letter was pretty fair. If you remember at the July 21st meeting, one of the agreements that we made was that we would have an operations manual before opening of next year. So that's the only outstanding thing. And then just for clarification, for next year, we would like the proof of trainings to be done in writing, because we did specifically ask for proof of trainings. But yeah, I think the packet was pretty fair, and I think there's two representatives here for the Summer House.
Any comments?
Very good season.
Just identify yourself, just for the record.
Xavier Severo. And I am consulting with the Summer House. We have out inspections pretty much every week, sometimes a couple times a week. No violations. We did a lot of training throughout the summer. Food handling, food safety, delivery systems and so forth. And with no violations, everything's been solved. That health department was very helpful. Sean is a very helpful guy with a lot of good suggestions. So happy with some.
Very good. Comments from the board?
Good to see.
Good to hear. So we just got a couple things to do for next season.
Yeah, just the one outstanding thing for
Okay.
next season. That's it.
All right, now, again, just as again, my agenda request, could we talk with no objections from the board, the short-term rental discussion?
You're good. Yeah, it wasn't a hearing, it wasn't any disciplinary thing, it was just enough.
No, we just wanted an update.
Just wanted to be responsive.
Thank you.
We really enjoyed working with Sean and we had a good season. We're having a good fall. It's beautiful out.
I know.
Yeah.
All right.
Why are we here? We should be out enjoying this.
All right.
Okay, thank you.
Take care.
Did we approve the minutes? Did we go through the process of approving the minutes?
No, we did not. I'm sorry. I was just reminded we did not approve the minutes. So may I have a motion regarding the minutes, please?
Motion to approve the minutes with correction of your name.
Second.
Any further discussion? All in favor?
Aye.
Aye.
Chairman says aye, minutes are approved with with my name spelled correctly. Let's now go back to short-term rental,
Yes, so let me go ahead and share the screen here.
because
One. Of course, it moved over here. There we go. So this should be what's, oh, no, it's not, it's just a moment. Sorry, I'm sharing the wrong screen here. Here we go. Okay. So I wanted to put this on the agenda because we usually tend to review articles that are for town meeting that affect the Board of Health.
right,
We didn't get a chance to do that when this article was originally passed 2 years ago. Because we didn't know it was even on the warrant is really the truth. So now we do have the chance to discuss it. And one of the most important things is in this short-term rental proposal, we're seeing a couple of changes that are highlighted. So this should be showing for the people at home as well. So in general, they changed a few definitions here. In this little preamble about the history of short-term rentals really doesn't affect the regulation much. So I'm gonna go ahead and get to the actual meat of it. So when they added the definitions here of what the definition of corporation, the definitions of apartment building, cottages, cottage colonies, deed restrictions, all of which we don't really have a objection to. They all match pretty well to the state definitions of these, and they all recall back to actual definitions that we already have. They're just clarifications. So from the staff perspective, we don't have a lot of objections. But please feel free to interrupt me if you have any questions as we go. So going through the definitions here. So this is where things kind of start getting, this is where we start changing the substance of the original bylaw. So in this case, no person or other legal entity shall operate it. This is because a lot of our operators operate under an LLC. So I do get this change, and we should have no issue there. Then as we start going down, the attestation is something we've been batting back and forth. It was there from last year as well. It doesn't change the substance more than anything. It's just a self-affirmation that they're not lying on the application.
So,
Is it enforceable? Only if they get caught.
so do they need to be inspected the first year, or there's never an inspection that is a state?
This first year, definitely no. We just don't have
Yeah.
a staff member to do it.
But
And
then
then
next year they'll be doing just attestations, or,
they'll be doing the attestation, and then we'll be inspecting based on complaint that first year. So
so we're waiting for something bad to happen?
unfortunately, yes.
Ah.
That's how a
And
lot of this.
What would be the penalty if they were caught attestation wrongly?
Then that it leaves this to interpretation. That's actually where the issue, that's part of the issue that comes with the short-term rental issue, changes.
Is that stuff all written in stone now?
It's not written in stone yet. And anything that's in gray is up for debate at town meeting.
Okay.
So right now, we're just overseeing what is going
Although
on.
it can't be more stricter than what is written.
It can't, when we alter it at the town meeting, that's correct. It
Right.
can't be more strict.
It cannot be
I
more.
guess I think that it was a mistake to say a renewal application shall include an attestation. Instead, it should be that there will be maybe intermittent like going and seeing the house,
Unannounced inspections.
unannounced inspections.
We can actually probably add that in the enforcement.
Because
side of it.
I just think you just don't know, and there,
Absolutely.
I mean, there are some houses that are rented that I think there will be problems with, and we may not know about them.
I agree. No, I agree with that.
So that's one suggestion.
That's definitely a suggestion we should put in the minutes. Then H and I gets hard. So specifically towards the bottom, when we start talking, and you opened up these two at the same time. This is where they start limiting rentals to 4 if you're a new owner, or 9 if you're grandfathered in. My objection with, I mentioned it to Ms. Barrett, when they were still under the short-term rental work group, that I don't see how we're going to be able to enforce this at all, the turnover. There is no software, Granicus wasn't gonna be able to do it. GovOS, Deckard, none of these groups are gonna be able to do that. What it comes down to is really self-policing, and that's, I don't think, good governance. But that's just where I stood here. But I do welcome any.
I mean, obviously enforce it, well, we'll talk later, but how are we doing on the new system, tracking system?
So the new tracking system.
Because that's key to all of this.
Exactly. So the short group, the small work group that we came together with, came up with a decision to go with one of the other companies. We'll be announcing it shortly.
Okay.
I just can't, we haven't engaged them yet, so
That's fine.
we haven't let the people know that they didn't get it, the other group. But Brian should be announcing that shortly. And then that group does say we should be up and running before December. We should be at user testing by the end of November. To be fair, to be honest, Granite has promised the same thing.
Right, but this new system still can't do a turnover.
No.
Numbers.
They show turnover just from what is publicly available via VRBO, Home Away, or something like that.
Don't they have to, I thought in Article 39, they had to submit a log of the,
They have to submit a log,
Could that be
but
part-
again,
I mean, it's the best you're gonna
Yeah.
get, but
Can that be part of the attestation at the end? They have to
That's part of the
indicate the
attestation.
short term, how many they've done.
whenever they go to renew their permit, that attestation says that everything everything in their application is legal to their knowledge.
So that includes
That-
past year's
Which
number
includes
of rentals.
past- Correct.
Thank you.
Trying to drop, Mark's trying to get in, but it's on the wheel.
Oh,
He can't get through the rail.
sorry. Thank you, Jericho. So yeah, that would be part of the attestation.
And whether this is the right time to mention, and we'd have to talk about this before, but the timeshares that are floating around I know there's not a lot of them, but initially they didn't apply because of tax laws and that, what one interpretation. Do these apply to that too, or are they still in that gray zone?
They're still in that exempt zone.
Okay,
So as far as, they're in the gray zone, but on the side of exemption.
okay,
Until definitions change.
Yeah.
For interval ownership, they're still in the exempt side.
okay. Thank you.
And so is there any questions on H and I before I continue moving forward?
Go right ahead.
And then J, which we don't have an objection to, prevents corporate ownership. Is what we're trying to do here from running a short-term rental.
But again, what existing ones are grandfather,
I'm sorry,
existing corporate ownerships are grandfather.
they are
Their
grandfathered.
grandfather.
Yes, they are grandfathered.
So basically, what's the difference? I know what the difference between an LLC and a corporation is, but I mean, can a corporation rewrite itself as an LLC just to get a permit?
There are,
It's the easiest thing in the world to do.
and a good attorney will be able to find any loopholes. Will be able to find loopholes in this
Okay.
regulation, which was our argument from the beginning. And then as we close out, it's just, there's a few issues here that they're cleaning up some language that we did agree on from previous years, so it's not a lot to talk about because it's just clean up on L and N. And I believe that is it when it comes to the changes. Yeah,
Let me ask,
yes, sir.
the select board may designate a town official or a town board to grant a waiver from any of these provisions.
Correct.
What would give them the right to do that? If you're gonna go by the rules we have, you should
Well, it's
need a waiver. for anything.
it's a mostly hardship waiver. I'm not sure the select board is,
it should say a hardship waiver.
unless it's somewhere else in there. I
Yeah,
can't
because
remember.
otherwise it's any old way.
They can just let whoever they want.
No, but I don't think the select board would do that, but there is a provision, a hardship provision here somewhere.
I don't
Maybe that's it.
I think I remember that in discussion, but I don't know if that was put into the actual. Yeah, it doesn't look like it was put into the regulation.
I think you have to explain what kind of waiver it might be.
This just looks like the select board can willy-nilly
If it's
choose
your best
whoever they
friend.
want.
Yeah.
Oh, my buddy has a house, we're gonna just rent them.
Well, I would
Waiver.
like this.
I don't
I would
don't
like to
think
think
that
the
everyone
select board
do
would be
that,
better than
but
that.
I do think that that is a risk.
I'm sure if they did that, I'm sure there'd be a lot of discussion in the
Well, they
local
have
press
guidance,
about that.
Some kind of guidance on what would qualify.
One way to present the problem is to put things in to prevent the problem in the first place.
So the good news is we may not have jurisdiction over the bylaw, but we have jurisdiction over the regulation. And in the regulation, we can, as far as the Board of Health goes, can always add in what type of waiver the Board of Health would be willing to offer. We can't dictate as the Board of Health what the select board chooses to define as a waiver or a hardship.
It could also be brought up at the town meeting
Of
about
course.
adjusting, the call and
I'm,
adjusting.
I'm sure there'll be a lot of this brought up at the town meeting. The question again is, it can't be stricter. So
So that won't get changed.
what do you want from us now?
So
A couple of suggestions you've heard.
So we've heard some good suggestions. Unfortunately, we can't change any of this,
Right.
especially considering finance committee is debating this exact thing right now.
At the same time,
Right now, which I imagine that one of our members of our group here is watching. They're watching at the same time, probably with an earbud. What I'm looking for, what we're looking for here is, does the Board of Health endorse or choose not to endorse
yeah,
this article, which is what we've done in many previous years with many of the other articles.
it is we're the regulators, so we can endorse it and put a comment in there
Correct.
if we want to.
And we've done that in many,
Or we
many
cannot.
times.
We,
Choose not to endorse.
we can we can endorse it, we can not endorse it, or we can do
Take
nothing.
no opinion.
We can do no opinion. What is the pleasure of the board?
Well,
I'll stop.
the meeting is November. This is September. Can we actually have time to go through this more with the, because this is the first time we're seeing
It's gotta be done soon because it gets,
for the publication.
it gets printed and
Okay.
The Board of Health endorsements do not get printed in the warrant. though.
yeah.
They get read out loud at the on the floor.
So if you want to think about it for
Well,
another
just,
month,
I mean, to be able to go through
Yeah,
the others, the
I
whole thing
think-
on the way for, if we could say we have questions, but if we have more time, we might be able to make more concrete suggestions as to what our concerns are and what would be a possible acceptable path, as long as it's not, again, as long as it's not gonna screw up the
Thing is,
process.
If we accept it, vote yes or no as a board, I mean, I would think that the only way we could address it is as long as it doesn't affect anything that the board has, I mean, if something's wrong and they have to come to the board, I mean, we can't just go right out and say, okay, I'm for this whole thing, because what do you do if, as a board, you might want to accept it, and I might not. So is that what we're gonna do? We're gonna vote on it the way it is?
well, we're just discuss what we're gonna do. I
I mean,
mean,
how can we vote on it the way it is if it hasn't been to town meeting yet?
no, we can give I mean, the select board voted to move these articles forward with a vote of 4-1. So there was one person who voted against it, but it still went forward then. And like, as Roberto says, our comments would not necessarily be printed,
My
but
question,
we can stand up at town meeting and say, the select board believes we endorse it, we don't endorse it, or we think it should be improved with this.
so my question to you is, if some of this stuff, this language might change at the town meeting.
Yeah.
Are we gonna have to redo it before we accept it again?
I think we could make a statement of what our opinion is, and that would be pretty much it. And then the debate will go on. So, and that will be it. It's really, again, it can't be more rigorous or stricter than what's there. And so there's not, to me, a lot of this wording that can happen at the town meeting. It's either going to get voted down or not,
Right.
and someone will put in an and or a but, but that's about it.
Right.
Also a major factor here is with finance committee being at the same time, they can alter their recommendation. If they recommend against it, it's a vote of 2/3 in order for it to pass. If they endorse it, it'll be a vote of just a simple majority, 50% plus 1. So if you would like I was hearing what Carrie and Ann said, if you would like to take another month to read this deeper, to read deeper into this, I mean, and to see what finance committee's motions were, we can also discuss this at the October meeting.
As
as
long as it
well.
wouldn't disrupt the movement of the process again, if we're not,
Yeah,
it
we're not
wouldn't
printed, so, you know, it's really a chance for us to at least know what we're getting the board.
And if-
to or not.
Right. If you're correct, our recommendation is not printed in the warrant, then there's really no reason.
It doesn't.
There, we can put this off for another month. I mean, I don't like to put things off. But if, certainly, I appreciate the concerns of the other board members that like a little more time. At least three of you.
I think that, we need to have time to, so I guess I'd like to hear Roberto
Mhm.
explain to me and to all of us, what is the purpose of us reviewing this really? Because we've just heard that we can't change anything.
Right.
Is it that if we made a statement that we were opposed to something, it would have influence?
It
Is
carries weight.
that the whole purpose?
Correct.
All right, so then, when we make that statement, if we make that statement, we have to be absolutely sure what we what we're doing, and because it's important, it could make a difference,
Correct.
right?
Correct.
And so I think it is important then to take that extra month, gather as much data as we possibly can.
Mhm.
So that when we either comment or do not comment, it really has some weight behind it.
And the other thing is, you know, my opinion right now is I think we should, as a board, we should stand clear of this whole thing. But because we don't want anything coming back at us. You know what I'm saying? I don't understand why they need us as a board to either say yes or no to this. I mean, I think that's for the public to decide at the town meeting, not as one board or this board or another board. Because everybody probably has, you know, different feelings about the whole thing.
Well, yeah, okay. So I'm not hearing
Well, the Department of Health, if I'm correct about this, is really about public safety, public health,
Mhm.
more than anything.
Correct.
It's not about who makes money and who doesn't or anything like that,
Right.
right?
Correct.
So I think in some way, if that's what we are, and that's what we're asked to be commenting on, what we should be commenting on are those sections that affect public health
I
and
agree.
public safety. Not anything else, because it's sort of outside of our purview, right?
Correct.
So I think we ought to zero in on those areas
Correct.
and get off of everything else, or essentially say no comment.
I think that's well said. So the consensus of this group is that we will revisit this in October.
Right.
And
With an eye, I'd like to say, sort of as a caveat, to those things that affect
Mhm.
public health and public safety.
Yep, I can do a quick analysis on that.
Yeah, that would be
And
great.
have that in the.
And
packet for
responsibility
next-
to
Great.
enforce what things
Great.
are
Right.
the Board of Health gonna have to enforce. We don't need to say
Well, we're gonna have to enforce the whole
thing.
Well,
whole thing, but
once we, yeah.
once we
comment,
get it,
we
but
gotta-
at least I agree. This was very good discussion. I appreciate all your
Do we want to make a
input.
motion to continue, or can we just stay able?
I don't think we need to make a motion.
But
We're not making, we're just putting it off to next week. It's just an internal discussion. All right, they're backed by popular demand. A lot of questions about the fertilizer regulation and enforcement. I have, all summer long, whenever I was invited to various houses, particularly some very close to ponds in the ocean, I saw some very green lawns.
Very.
I mean, I'm talking about very green lawns, and it wasn't paint or astroturf. It would, and this has always been a problem of us of these regulations, so I was wondering, how we're doing and what are our plans for the future and how we can make this better.
So, and I know that there's a couple people in the audience who.
Yes, we'll let them speak.
So there's more good news than bad news. So that's a good thing. So we'll start quickly with the bad news. The articles that we endorsed actually for last time meeting are still wallowing in committee at the State House. It doesn't look like the ban will pass. The outright ban that was passed 2 years ago, that sat in committee and that looks like it's about to die on the vine now. And then the change in regulation that we requested last town meeting so that we can change our current regulations are still sitting in committee. Last time we spoke with a Representative Fernandez and Senator Sear, they were going to try to continue moving it forward through the committee, but it's stalling. And unfortunately, it only goes through 2 legislative sessions before it gets killed. And we just lost the first legislative session, what with it still being in committee. So we have about 1 year left of it being in committee before we could get it onto the floor, if things go well.
Even though it passed here and we said that we want this, we have to wait for the politicians to say, yes, you can do that.
Correct, because it was a home rule petition. So in 2000, correct me if I'm wrong, guys, 2009, 2011, something like that, when the state preempted fertilizer at the local regulation. 2012.
So, yeah, 2010, those when we started the 60-acre corridor. But we passed in 2012, and I think that's when it's barely missed.
Correct. So,
Just for the record, you identify yourself, please.
oh,
Yeah, sorry, I'm Mark Lucas.
and yeah, if you guys want to get closer.
Yeah,
to
why don't you
the
come up here?
microphone, feel free to get a seat at the table too.
Here,
You can sit, this is a,
Yeah. And
Yeah.
this is not an official public hearing. This is a,
No,
just,
sure.
we're just questioning, update, it's an informational discussion.
yes.
Thank you.
So in 2012, when that regulation passed and the new law passed, they gave all local boards of health on the Cape and the islands only 3 years to alter their local regulations before they were set in stone. After that, after 2015, we were no longer allowed to change our regulation without a vote from the State House.
Unbeknownst
And
to
then-
us, by the way.
And it was unbeknownst to all of us.
We didn't know.
So we had the whole fertilizer advisory committee, which both of you were members of, and we came up with a whole new regulation to bring it up. And as we were presenting it, town council informed us that we can't pass this regulation without a state vote. So that's why we had to do that article at town meeting last year. And until you said the politicians on the Hill decide to gain us with the glory of their presence, we are not going to get them to vote. Julian and Dylan are working on it, trying to get that through committee. And they've, last time I spoke to Julian, there was a co-sponsor as well from other towns on the Cape. So it is gonna move. We just don't know when. And if it gets killed at committee or on the floor, we have to bring it back to town meeting again and start the process again.
Just to build on what Roberto said, the regulations and the BNP, the best management practices, very big document, took a lot of time. They were always meant to be living documents, change, evolve, tighten up if necessary. And we had some good ideas prior to what Roberto said, when they said, sorry, can't do it.
Yeah. It felt like, one of those Looney Tunes anvils just fell and ruined everything for us. Like we all thought we were ready to vote this in. And then countless state laws preempted our change. So that's where we are as far as the bad news. The good news is we finally got all our comments done to NCTV for the videos. They're going to be they're editing the videos now for the new training program. I don't have a timeline on that right now. But once I'll get in contact with Charles again. And once we get a date on when that'll be up and running, I'll give an update here. But the good news is that that program with a new test should be up and running and available before this upcoming fertilizer season. So that's probably the best news we've had on fertilizer in a long time. And Mark did the fertilizer calibration, the spreader calibration video, which is now edited and annotated. So there are 5 specific bullet points that were covered. Those are now on the video and they will be showing up. People will be tested on each individual video. And there are expected to be 5 videos, all covering how to read a fertilizer bag is one video. Spreader calibration is another video. Soil testing is another video, which Mark also did. There is an introductory area and then a watersheds video that we were working with Natural Resources to get that completed. And all of it was done with funding from the Nantucket Land and Water Council. So we really appreciate that.
Thank you.
Is the videos in multiple languages and captioning?
The first videos that are going to be brought out are going to be just in English with subtitles in multiple languages.
Okay, we don't need the subtitle. I mean,
Yeah.
just somewhere that we're getting through and just.
Correct.
Thank you.
The original for the videos as of right now are going to have individual subtitles. The only validated subtitles we'll have are going to be English, Spanish, and Portuguese. The rest are going to be auto-generated subtitles in other languages. However, we are hoping to be able to get videos dubbed in other languages once we roll this out.
I mean, that's all great news. But how do we get this information out to the homeowner? Because I'm always hearing, well, we really can't enforce it. We can't go on people's land. But I see it. Rules broken all the time.
The intention of these videos are to be able to make them as public as possible. They'll be on our website, they'll be on YouTube. The test will be accessible. The BMP we're looking to also summarize the BMP to make it more readable for your average homeowner. That is the next step, and a complete revamp of the webpage with that. The discussion that we had with actually Matt Fee on the select board was possibly putting this in a new homeowner packet that might be sent
Yeah,
out.
we've talked about that. Is that
Yeah.
actually going to happen though? I've heard of this for 3 years now.
We've tried it on our end. It depends. It's herding cats with all of our departments. So I don't know where that stands right now. But I do know that there is, Janet Schulte has worked on through the whole Government 101 program that she's
Right.
developing. Part of that is kind of a welcome to Nantucket. These are your expectations. These are our expectations. So.
Emily, yeah.
Thank you. So I know most of you, but Emily Molden, again, the Director of the Nantucket Land and Water Council. First of all, thank you for putting this on the agenda. I do think it's really important. Obviously, these are Board of Health regulations. And I think it's important for you guys on at least an annual basis to hear and understand and have some reporting on the licensing program as far as how productive that's been in any given year. The licenses are good for 3 years, is my understanding. So keeping tabs on how many of our landscapers do have licenses. There are a lot of important elements that it's good for you guys to stay up to date on. We have been feeling for a while now that in general on the island, collectively, there's a lot more that we can be doing to help with fertilizer impacts. I don't want to take up too much of your time. We held a State of the Harbor Forum this summer, and our eelgrass specialist from Boston University presented her research from the last few years from Nantucket and Nantucket harbors, including a health assessment, including looking at nutrients and nitrogen sources. And when she was asked by an audience member, what is the most important thing that Nantucket could do to save our eelgrass and improve the water quality in our harbors, she said unequivocally reduce and or eliminate nitrogen from fertilizers, and you will have improved water quality, and eelgrass will certainly start to bounce back over time. So that's a big deal. I mean, there are a lot of other nitrogen contributors, but fertilizer we have so much control over. clearly, I think that the biggest impact we can have as a community is through education and also through regulations and enforcement. And I know that my organization and others can certainly continue to do more on the education front in collaboration with the town. We also think that there's a lot more that can be done from the town's perspective with the regulations, whether it's the implementation and management of the licensing program, enforcement of the regulations themselves beyond just what needs to be taking place on private property, because I know that that's a challenge. But I think there's more that could be done around enforcement, and then also promoting educational opportunities and outreach for property owners and for landscapers. And I think that in the past, there was this fertilizer work group, this advisory group that was formed out of the Article 68 years ago, 2009 or 10, whenever that was. And I know that that group has kind of been abolished. I don't know if it would be helpful to have something like that reestablished for more engagement with the landscaping community and to provide additional motivation and ideas with the town. I also question and wonder whether another position at the town between the health department, natural resources department, that could really oversee and focus on these tasks. I mean, I've brainstormed a list of ideas. Some of it is from the fertilizer work group discussions in the past. Some of it has been from discussions directly with Roberto and with Jeff. And I just don't know if the time and resources are available in the town departments right now to do what we could and should be doing with fertilizer. I think that it should be more of a priority. And I think my real interest and excitement in being able to come and speak with you guys today is to start to brainstorm and figure out how to improve that, because I feel like we keep losing too much time. Seasons go by and we sort of have these lost opportunities. And I mean, I'd be happy to put some of these in a letter to the Board of Health and start to brainstorm how maybe we could create more staffing opportunity at the town level to focus on some of these initiatives. But I just do think there's a lot more that we could all collectively do.
Yeah, my name is Mark Lucas. I work in Nantucket Golf Club, so I'm not a landscaper necessarily. I don't, the fine lawns that you're talking about. Sometimes I wish I had those, but we don't. But I think a lot of what Emily said, I absolutely agree with, especially when it comes to staffing. Having seen what Roberto has to take on responsibility wise, and just talking about the short term.
Well, he's got,
Yeah, I mean,
he's got to manage this.
and
now.
Jeff too. And before Roberto, it was Richard. It's just, I think it's too much. What everyone expects, the town, citizens, landscapers, us, I just think it's too much what they currently have for staffing. It's a big ask, it's a big program. And so I agree with Emily on at least one more staff member full time, maybe 1.5 more. Just the help of all these programs. I'm really excited to hear about the test. I think that's great. And there are ways to save money. I think you don't need it necessarily to be staff in person, Proctor. After COVID, things are a lot different now, and the state relies on testing without in-person proctors. So there are a lot of things I think like an advisory board could help with if that was something that is in, Roberto and Jeff were interested in. I really would love to see more of the landscaping community step up. It's kind of the same people all the time.
That's anything I've ever been involved in, it's always the same people.
I know. And I coach sports and it's the same way, but like, not that we wouldn't, we want to be involved, but people that have always been involved, but we need other people to be more involved. And I think a lot of the landscaping communities changed over the last even 3 years, 5 years. I'm sure they don't even know the regulations anymore. A lot of them.
Could it be tied to like a business license? Like you have to get a new business license every 4 years. I'm, as you were talking, thinking of like, you have to show like If you go to the package store, you have to show your license.
No.
So if you're gonna go get a business license to run a landscaping company, or if you're gonna go buy fertilizer, you have to show your license, whether you're a homeowner or a landscaper, that you've taken the course. I mean, you'd have to have the stores buy into that sell it, but I just wonder if there's a way to like have it so you have to have this license in order to obtain, I mean, I guess you could take the boat off island and go buy it and bring it over,
Yeah.
but if you
Yeah.
do.
some sort of way to make sure people are getting the licenses and.
The answer is yes and a maybe. The maybe is, it's the same thing as before. We would have to write the regulation and have the state house review it for fertilizer specifically. The other maybe behind that too is to show your license or could have business license attached to it. We would require the licensing department, Amy Baxter. We would have to change some bylaws to get that to work together.
And I do think
It's
another
not-
person.
Yeah, it's not impossible. It's just, it's a lot of work, and I also don't want to blindside Amy because you think I'm short-staffed.
Right.
The reason I say licensing and Amy interchangeably is because Amy is the
She
licensing
is,
department.
she is the license.
But if we had somebody that was working sort of between you and Jeff
Mhm.
and could work with Amy with the licensing, I just think like if you want things done, you have to hold people accountable.
Of course.
I don't know how you enforce it, but I do think,
And
we were talking about, you know, before we found out that we couldn't change anything, we were talking about annual reporting. We were talking about, the Department of Health or Natural Resources being able to come and look at your inventory to see if it was, you're legally able to apply that. I mean, I think there's some good things if we're able to do those, though. I keep saying it. He needs more staffing. And I'm talking with you guys and I'm sure you agree. And I know it doesn't stop here though, select board, but I think the town really has to buy into it if they want things to change.
Let me ask a question. Some of the responsibilities on the owners to know what's going on their property, or is it just that an owner will say, you know, I want my lawn to look beautiful, and these guys will just buy whatever they need to do to make it look beautiful?
I can't really answer that because I'm really not in
under,
that profession, but I would, if I had to guess, I'd say it's a little both.
it's a little of both, but the bulk of the responsibility under the current regulation lies on the landscaper.
Yeah.
Because we weren't able to change the regulation.
If I could just add one more thing onto what Mark said and something he brought up earlier, I think that and it's certainly too bad that it seems we can't necessarily make the amendments to the regulations that we had been hoping to, because there were some good ones in there. But I do believe that the licensing program itself and the best management practices, which are referred to in the regulations, have some flexibility and some room there. There could be specific requirements to get a license that maybe involve some kind of reporting. I think that there are ways to look at developing the licensing program on its own and maybe make some changes to the best management practices without having to actually amend the regulations. But again, it takes time to be able to sort that out and then ultimately implement it. And educate people about those changes, what they should be doing, and then patrolling and or enforcing as possible. So again, I'm happy to submit a letter with some ideas and try to carry this conversation forward with the select board and others. But I
Well, to me, a lot of it is the homeowner's responsibility.
Yeah. I think so too.
I think they just don't know. They just don't know.
There's a significant amount of turnover.
And so-
you know, as new people start in,
I would-
I'll have to be brought up to speed.
I have a great idea for a 30-second commercial, but I'll save that if I can find the funding and the personality to do it, but So do we want this committee to reform? Is it worth, I mean, we have we have a lot of committees.
Yeah.
Working group,
Yeah, it would be like, first of all, that was with an interest, I think, Jeff and Roberto. And I think it's an advisory board that just helps them. I mean, they have too much.
well, as advisory boards and committees don't have to be appointed by the select board.
Is there a way that we can kind of force the companies at least to attend a concern session? I mean, kind of like, almost like these are our concerns. What are your concerns that are not making these two things come together? And just kind of, if we could, I would love to see more life, but knowing licensing stuff is going to be complex. Is there any possibility that landscapers would be willing to, participate in like a session to just like, here's our concerns, what are your concerns? And just kind of say, people are really looking and thinking, and we're trying to figure out a way to stop it.
I don't know, but I will say, when we first enacted the regulations, we had actually Nantucket Land Council at that time with Formac. And you were there, but you guys sponsored an educational program with UConn. I mean, how many people we had there? 100, 150 lands?
I think that was the first.
Yeah, you had to go to get your license.
No, I don't think so. Not that one.
Not that
It was another one. But I think there was a lot of interest at that time. It's trying to figure out how to get that back. And maybe if they know that, if everyone knows that this is coming back again, it always does. I always tell people that this is not going away. But if they can really buy into it and also have, like you said, if it's a give and take, like what's working on their end, what's not working. And, the Department of Health and the Department of Natural Resources does the same. I think it'd be fairly well attended in the off season.
I mean, as far as landscaper education, that's something that I know we would be very interested in helping to provide more of. And it makes sense to do it in partnership with what the regulations and the best management practices are. I think that landscapers are much more likely to invest in that education and go in that direction if they're also aware that the regulations are sort of incumbent upon them to do that. And then we also provide the education and the tools for how they do that. And more homeowner education, I think, is also.
I think we have to approach it from that side. I really do. I have a son who's an architect, and he ends up many times doing something sort of that he absolutely does not want to do from a design standpoint. And, I'll say, well, why did you do it? They asked for it. So I think we have to approach it from the homeowner side. I really do. I think that most of our homeowners, we have some that wouldn't give a darn, but most of them are concerned, involved individuals. And if they've really understood, I think it would help. And I think that we need to devise some sort of a way to educate them. Now, I don't know whether there's something we could mandate. I can't see, if you want to be able to, I don't know what, have fire protection or something, no, but some sort of something that they have to be trained. My second question is, and I have no idea what the answer to this is there a safe, good fertilizer? Is there a substitute?
Can I answer that question? I'm involved with a company called Biochar now. Okay, I buy my fertilizer, my salt, I have it shipped from Colorado all the way to my house. I spent $2,500 to get my fertilizer here on my grounds. And I tried to talk to people around here to look into that company. And just never went anywhere.
Well, I mean, I think, and I'm sure Mark has an opinion on this as well. I think the answer is yes. A lot of it, and our regulations are based off the science of how much nitrogen, how much nutrients can the plants actually take up in a given amount of time versus how much is going to be lost into the soil and groundwater ultimately. So there definitely are huge benefits to organic products that help to build up the biodiversity of the soil, and you just get a healthier landscape from that side of things. But as far as good fertilizer, a lot of it really has to do with how much is applied, under what conditions, over how much time.
Calibrated correctly.
But is there something that makes things look good that doesn't have nitrogen?
Well.
Yeah.
Mhm.
Yeah,
Okay.
but I mean, eventually the plant needs nitrogen, but, because, I mean, you have it in the soil and biochar bring, will help with that, but eventually you run out of nitrogen for the plant. But yeah, I mean, we use iron, we spray iron onto the turf, to make it look great. We're at a different, we want the surfaces to be really hard and
Yeah,
fast.
yeah,
And if
yeah,
you over fertilize over water, it doesn't work that way.
yeah,
So,
okay, okay.
But still, some people, very few on this island, but there are some professionals who do spray their fertilizer. And that's a really good way to do it because it's just going to the plant only.
It doesn't get so much in, yeah.
In the regulations, there are maximum limits on that too. But I kind of go back to, it's been a long time. I think a lot of people just like.
The regulations are really being implemented. I think a big piece of the education component, especially for property owners, is really encouraging the use of more native plants that don't require fertilizer in order to look good and be healthy and don't require the irrigation. That's another piece of that. But that is digressing. I 100% agree with you. I think it's a two-part process moving forward. It's the property owner education and it's also the landscaper education and regulation and enforcement.
And we always do that. I remember Wendy McRae, she was on the Article 68 work group with us and she was trying to figure it out. And she came up with the idea of putting like educational literature into the tax bill.
Yeah.
That you get annually. Town didn't go for it though. So I kind of feel reverse entertaining. It's like, how do you get that information to the homeowner?
Can we not do that?
I don't know. At that time, we weren't allowed to do it.
So what I'm hearing is a lot of good suggestions. So I think we have two volunteers here that would certainly maybe put a list of ideas together. The question, do we want to include more people in the community? And we're getting into committees and working groups, and that gets complicated.
It gets complicated.
Yeah.
But we are part of the Clean Water Coalition. There's now 3 town members.
Right.
in the Department that's up there. As well as the 3 nonprofits.
I mean, it's
More than happy to continue the conversation.
yeah. If you have the time, if you could just outline,
I would love to just put some thoughts in the
just
letter.
put some thoughts together and send it to us.
Yeah, good idea.
And then if you want to put it on an agenda again and follow up in a couple months.
Just send me a letter and once we get it, we'll put it on the
Okay,
agenda after I get it.
okay.
Thank you.
And that would be
Okay,
quite
thank
helpful.
you. Okay.
I think this has been good for the committee because so we have newer people that weren't here back
Okay.
when all this started, and the best practices document though is an excellent document.
It is.
And that needs to be updated. too.
Okay, thank you very much.
Thank you, guys.
Thanks for your time.
All right.
Gas comes off that too. It's gonna grind though. Thanks.
Yeah, I just don't want this to be discussion. I appreciate that we actually do something.
Yes,
Yeah.
thank you.
Yes, now, there was this review of what's called the Fire Department Cancer Report. And it mentioned at one point, maybe we should talk about it.
I did see earlier, I don't see him anymore, but I did see that Jim Bernica, the
Yeah.
person who authored it, was on.
Yeah, he was gonna come on to answer any questions.
I
we had.
don't know if he's the phone call, so I'm just gonna see if it's.
Yeah, and then I know I asked the chief if he wanted to come by.
So the person who's on the phone number, can you unmute and tell us who you are?
It's me, it's Jim Bernica. I just switched my phone from the Zoom app.
And that needs to
Yeah.
be turned up.
You guys hear,
Brought my hearing aids.
Yeah,
you
that way
guys
we
hear
can.
me okay?
Yes, sir.
Okay,
Great, thank you.
Yes, so Jim is on. Just want to give a quick review. It was discussed at the last meeting that to put it on today's agenda. And I don't have any direct updates, but we do have the person who wrote, and we can just open it up to the floor.
Yeah. Yeah, let's do it that way. Anyone have any discussion, comments on the report? Then we can ask if we have questions about it.
I thought it was fascinating. I think that we have a real problem. I think that we have a fire department that is very well staffed as long as we have no fires. And if we have a
We're not-
fire,
It has to be health issues.
well, right, but it is a health issue
Okay.
because what is happening and what we saw at the Veranda House fire is that we had people having to go into the fire. We had 5 firefighters that were sent to the hospital because they for a variety of health issues. They had to call the hospital to come down to take blood pressures and to administer oxygen, to take firefighters to the hospital. I think that we don't have enough firefighters to fight a fire for them to safely, because they are constantly being exposed. One of the things that he commented on is that when they come out of a fire, that they would then go back to the firehouse and take a shower, and the off-duty firefighters would cover while they were doing that. And I believe that the shower that they're supposed to do takes like an hour, except that because we have so few staff, there really isn't anyone. So the people that were on all night and day the night before, then were on for another probably 12 to 24 hours. And then the people that came on that, so there just aren't the staff. I know there are a number of firefighters that live off island, so they're not able to, if they're not here, they're not able to help respond. I think they have an increased risk of exposure. And I was told that in the firefighters' contract, it says that the town will pay for them to have physicals and cancer screenings. And then when it came down to it, the town said that they would not pay for it. And it was $11,000. And the town said they
Well,
would not pay for
If
that.
it's in the contract, that,
They were told they wouldn't pay for it.
well, it's a union issue with the contract.
But this is something that's really important because firefighting is a very high-risk job. They're exposed to a lot of carcinogens, and I don't think any of us have jobs that we're exposed to things like they are, and we're saying, but we're not gonna pay for you to have screenings so that if you got diagnosed with something early, and I worry that the town is liable if a firefighter develops a cancer related to these exposures. They have an injury related to not having enough staffing to change out. They're only supposed to go in for 2 oxygen tanks. And then they're supposed to come out and have their vitals taken and rested and before they go back in again, but we don't have enough people, so they are constantly being exposed. Whereas if there were more people, they could rotate better and not have as much exposure to these carcinogens.
I wonder, it was a very comprehensive, very dense, had a lot of pieces to it. Some of them seemed very important. There was good news. It wasn't all bad news. I wonder if Jim could highlight the takeaway, what we should be seeing, what we should be hearing, what we should be focusing on. Could you do that?
Yeah, I could certainly do that. And thank you for the opportunity, and thank you for taking this report seriously, because it is serious. It is, we're talking about our firefighters' lives, and but also their families and everybody else on the town as well. But the exposures that we get when we have fires, I mean, we never really even know what we're exposed to. I mean, every fire is different. There's all sorts of different carcinogens and chemicals that off gas are in that fire, smoke, and soot. So, there's several important things. First of all, I really don't feel like there was enough firefighters that are available on a fire to do things safely. The last paragraph that I ended up writing on that, and I know that's gotten a lot of attention, but the idea behind that is, in order to let's pretend the the firefighters get the fire out. So the fire's put out. But that doesn't mean that their job is done. They still have to go in. They still have to do overhaul, which means they're looking for any other hot spots, any other fire that they haven't put out, and they're just trying to make sure that the fire is absolutely out and it won't rekindle. But just because that fire is out, does not mean that scene is safe. So there's still all sorts of different chemicals and carcinogens in that fire atmosphere, even in the overhaul phase. So, I mentioned in there, either firefighters are going to die sooner or later. So what would happen if there was enough firefighters, when they would go in and do overhaul, they would still be wearing their SCBA, their air mask, and going in there and conducting overhaul on air. And that way they don't have any inhalation exposures. That doesn't happen on the island. That practice is not there. So every time there's overhaul, these firefighters are not wearing their mask and they're getting exposed to who knows what. Every single fire, it's that way. And the reason is they do that, even though they know better, they are exhausted. Fighting there's not enough of them. They fought the fire. They finally got it out, however long it took, and they are exhausted. But yet there's still not really a lot of help coming. So now they got to go back in there and basically clean up the mess they made. So because of that, again, they're getting exposed, and that long-term exposure, that's going to add up. And it could eventually, 10, 15, 20, 25 years, whatever the cancer latency period is for that individual, they could get diagnosed with cancer. So it's not something that's very abrupt right then it's going to happen. We're talking years later down the road, this stuff is going to catch up and affect that firefighter's health. So my recommendation was you have to put on that mask. You have to have that in order to do overhaul. But if your firefighter is already exhausted, already dehydrated, and now you're going to put a pack back on them, which weighs another 50 to 75 pounds, and have them work some more, my fear is that they're going to have a cardiac issue. And that's already happened on that department. That's not anything I made up. It's factual. That has happened. Having a firefighter that's just overworked because there's just not enough of them, and they keep working until literally can't. They have a heart attack. So it's because of that there just needs to be more firefighters available. I love the fact that the town has really thrown a lot of money into the infrastructure. Like they've in the last 2018, you can look on the website, $30 million they put in. They've got a great new firehouse. They have new apparatus. But I've never seen a fire station put out a fire. You need people. And that is something that is just lacking right now in this town. And to me, it is just terrifying. I'm worried about those guys. Apparently, I feel like I'm more worried about them, the actual town manager and the fire chief. I'm suggesting we got to do something, because what's going on right now, it's either going to catch up to them sooner or later. That's something I stand behind. Like there's a big gamble going on right now.
Okay. I think we got it. I have to.
All right.
Right. Yeah.
The biggest
I could keep
takeaway
going,
then
but,
is that
you're right.
it's understaffed. Is that what we should be taking away? Is that the number one impression of
Yeah.
the entire report?
You need people to safely do this job.
Okay,
Absolutely.
okay.
And are there no people because of budget? Because we can't get people to live here?
No,
Complex.
I think the town is doing a lot
Mhm.
in a way to hire people, and they are hiring more. the issue always comes back to housing, cost of living here.
All of the firefighters, at least all the ones that I know, all have other jobs
Yeah.
because the town does not pay them very well.
So, but I would challenge a couple things you said about the cardio risk of young people hauling things. I'm not sure that's totally
I
correct.
think there were firefighters that had cardiac issues after the Veranda House.
Okay,
fire.
I'd like,
I-
again,
I can,
I'd love to see that.
yeah.
I'm sure
no,
they do, but that's,
There's someone with their hand up right now.
yep. Go ahead.
Aisha, just go.
Aisha.
Guys, thank you for taking my call. I want to show that this is actually quite an important topic to me. Malcolm, it was Nate, my husband, who had a cardiac arrest after the Veranda fire. My worry with a lot of the information is that at that fire, and I hope we do things differently, at that fire, there was, as the guys were going in, they just kept having to go in over and over. There was no rest and rehab. There are supposed to be, you're supposed to do 2 oxygen tanks, and then when you come out, there is supposed to be someone there with liquids, IV, taking blood pressures. I mean, this is like a very standard thing that's set up by the NFPA, which is the National Fire Prevention. It's an industry standard, and they have a lot of these which talk about staffing, equipment, safety protocols, all the things that can help make this very dangerous job less dangerous. So that's one of the things that they say, is that we should have, you know, someone there to take blood pressures, to make sure that the firefighters have rested, that they're okay to go back into the fire. That is not possible when you're using every manpower you have and then asking more and anyone on the street to help. We didn't have that. So that is a concern with the fires, is these exhaustions. Now, it was so bad that we did put out like a, Mayday SOS, where we got basically the hospital to come do that, because the firefighters were dropping like flies off the group, and then you have to get somebody to drive him too in the ambulance. So it is problematic, and it takes and cuts down a lot on the staffing. There's also like an intervention group. Of course, we don't have enough staffing for that, where they stand at a fire ready to go in if there is a mayday, if somebody goes down, if somebody falls. We don't have stuff like that. And I think the issue that I'm hearing, and I know this is not about staffing, but the reports, there's a Novak report, which is excellent. I've gone through it over and over, referenced it. It talks about all the departments and staffing. Excellent report. There's that report, and then there's this cancer report. So there are 2 different reports, and we're saying staffing's not an issue, and we're looking at the 2018 Novak report. Great report, except the report, there's parts in the report that says they base their numbers, and they're saying we meet the numbers required by the Novak report, the no firefighters on an apparatus, because it's very important. So they base their numbers on what the Nantucket Fire Department was doing in 2018, which does not meet industry standards. Industry standard says you can, yes, have 3 firefighters on an EMT call. So basically, we're saying that we are fully staffed when we staff it up to, I think it's 9 people, 10 people, I think was the goal, or 9 per shift and 1 chief. When we have 10 people on a shift, we will officially be able to meet 2 EMT calls, or maybe 2 or 3 calls, without calling firefighters into the station. So we can do 2 ambulance runs. Great. 2 or 3 ambulance runs. That's wonderful. We will not be able to meet a fire with those standards, because the NFPA, what they recommend, if there is a call, if there is a fire, and that's a health and safety thing, meaning people in our community who are calling 911, we are recommending that there are 15 firefighters who show up. The goal is within 8 minutes. That's what they recommend. And that's with NIST has done studies on that. And I'm happy to connect you guys with them. So we can't meet that 8-minute protocol or even get close to it with 15 to 16 people. Also, they say first initial response is 4 firefighters within 4 minutes to that fire. Now, a fire every 3 minutes gets 16 times stronger. So if you are a person inside there, you are royally effed
Okay.
if you
Right.
are waiting over 10 minutes for someone to
Alicia,
show up.
I don't want
And
to cut
if
you off.
we have
but
one central station, oh, sorry.
I got
But what what I was saying was, so that Novak report is
One quick
talking about
comment.
staffing and what, oh, sure.
No, that's all right. I get it. I mean, you are a fabulous spokesperson. You should, you're like a PR person with fire department. You do a great job with it. I think we all appreciate.
But my worry is that in the Novak report, when we're saying we're fully staffed, that's why there's confusion, because we are not
Yeah.
talking and accounting for fire. So, and this cancer consultant report is specifically only talking about exposures to people and firefighters at a fire. So if one report is saying we're fully staffed without a fire, we're comparing two different things. So they're both accurate, but we need to have staffing for a fire. Does that make sense?
I absolutely makes sense. I haven't read the Novak report, but you make great sense. I mean, again, the staffing is related to health. I just want to make sure and health and
Yeah,
safety.
that is, it's because they are having to constantly be
I gotcha.
exposed. Where at a bigger fire department, they would be able to have a break and not
Mhm.
constantly be exposed. I mean, the fact that
And the cardiac arrest issue is
Not
really
only
big.
firefighters' health, but the public's health. And that's what we sort of have to keep in mind too.
Yeah.
Because, we've got two sort of audiences here. And the public's health, if the fire department is not fully staffed enough to handle medical emergencies and fires, that's putting the public at risk.
if
as well.
someone had an overdose or a heart attack at the time
Right.
of the Veranda House fire, they would have just died.
Right,
Because
exactly.
there
So,
was nobody. to
but you
respond
also have
that.
to say that might be a once in
But
very.
Well, there was
lifetime
another
event.
one a couple months later.
Okay,
So
It gets down.
clearly.
all right,
something
let's one at a
needs to
time,
be done,
one at a time.
And we need to.
It gets down to, we need people. And the reason we don't have people is we don't have housing. And we're not gonna have housing till the town recognizes this and takes some money from somewhere. Instead of giving the land bank 2%, how about giving for the next 2 years, the land bank 1% and take 1% and give it to the fire department?
Well,
I
that,
also think that as the Board of Health, we should look at making sure that the firefighters are getting screening for cancer, especially the ones that were at the Veranda House fire, which is probably all of them. So that we, down the line, this could have grave effects on them.
right, a couple things. I think the town is pushing really hard for housing right now.
Yeah.
I think it's the number one priority of the town, and it's a difficult way to go. I mean, until the prices of housing come down on this island, we're always going to have a housing crisis. Even if the more houses we build. And the issue with the land bank and the money, that's a political discussion you can bring up at
No,
town
I
meeting.
know, I know, I know.
Not here.
But,
I want to keep this focused on health and safety. That's our function. There's enough other political problems in this town that we don't want to drag ourselves into unless it deals with health and safety. And here we have an issue that does deal with health and safety. So the sense is that obviously it's a very difficult situation. And from talking to the town, the people in town, they're doing what they can to get housing, and they're doing what they can to hire more firefighters as fast as.
Well,
they
money
can.
talks always,
Yeah.
and sometimes, you have
Housing-
to just bite the bullet
Housing,
and
money,
just.
and also have to have a place for them to sleep, not on the Cape.
No,
It's a
but
long way to come for a
you
fire.
can get almost anything if you pay enough for it. And so I think that could be something that needs to be looked at.
Don't disagree.
But I mean, we do need to, they should be getting cancer screenings.
Yes.
Well, they should be
And they're
getting,
not. They're not getting.
they should be getting health screening in general.
They're not getting
See, I don't understand that because you told me it was in their contract, they got it.
it. Yeah, and then when they went to do it, it was denied. It was gonna be
Well, they can't-
$11,000 and it was denied by the town. I'm just telling you,
11,000.
Is that something, Roberto, that you can look into?
Yeah, wait a second, 11,000 for a health screen, what does that health screen involve?
I think it was physicals for them and health screenings, because it's recommended that they have skin cancer screenings. Yeah,
What's
contract
that?
called for cancer screening and would.
Is that 11,000 per firefighter or
No,
11,000
it was
total? So
total-
that's a-
total.
That's a total.
Oh,
Okay, okay.
Yeah, I mean,
Yes,
that's, yeah. I mean,
cancer
that's
screening. It was $11,000
to
total,
do the
not
whole
per,
thing. And I think, I want
to
to make
do
sure.
the whole
we're
department, and
clear on
they were
that.
told no.
All right.
That
yeah,
actually-
good. I'm glad you
that
thought.
that actually sounds inexpensive.
Yeah.
Now it's. Now we've gone the.
I
other
was
way.
gonna say $11,000 to screen the whole fire department. That's a pretty good deal.
Well, there's only 26 of them, so,
That's the look at
All right,
it.
that's something we have to look into.
yeah, I just
You,
think that,
you asked something.
No, I was saying to Roberto, is this something that you can sort of look into, if it's in the contract about the health screenings? Are they being done? When are they being done? How are they being scheduled? Is that part of
In
your
my,
purview?
in my position as the health director, no. However, what I can do is just let all of the chief and human resources know that this discussion was had. I'll point them in this direction so that they can watch it.
I
and then
think
they can-
we can say, because it's very clear to me that the Board of Health has real concern about the safety, health and safety of its
I
firefighters.
think it's a very strenuous, very difficult, and very hazardous job. And they certainly need adequate health care. And certainly, particularly if their contract says they get something and they're not getting it, that's just not acceptable. So we really have to look into that. Maybe I'll talk to people about
something
that.
like that should be just part of your job. Like, I am expected, working per diem at the hospital, to get a flu shot every year. When I worked out in Washington, I had to be screened for TB every year.
Mhm.
So, and that was not negotiable. You have to do these things. So I think for these people, it really should be a non-negotiable because they're exposed to such
Yeah.
awful things.
The problem with cancer screening in general, again, the epidemiology and whether an individual cancer is caused by an individual situation, it's extremely hard to say person Y got cancer because they were exposed to A. It's very hard.
I'm sure there are regulations in other fire departments
Yeah.
on what types
It-
of cancer
It
screenings.
still needs
are
screening.
recommended.
The problem is, my point is bringing it back to a specific person to a specific cause is almost impossible unless you're sitting next to a nuclear bomb or something. But so I will take it on as a chairman of your committee and board to look into this issue of why they're not getting screening and medical exams.
Let's bring it up again in another 1 or 2 meetings.
Well, I'll bring it
We'll
next
see how
meeting.
you,
I will
yeah, we'll
report,
see what you've found out.
I'll report to you next meeting.
Yeah.
Okay,
Good.
thank you all. Thank you for your input, everyone that
Oh, I
participated.
should.
Yeah, really, 1 minute, Alicia.
Actually, you're still muted.
Hi, I'm very happy to provide, there's a lot of peer-reviewed research on chemical exposures to firefighters, so I'm very happy to provide that for you guys. Thank you.
Thank you very much.
And Jim, thank you. Really appreciate it.
Thank you.
Thank you.
Okay,
Thank you, guys. Have a good night. Appreciate it.
You
Thank
too.
you.
okay. Update on behavioral health response and COVID clinics.
And this, can you bring this back to?
Pardon me. So my name is Jericho Mealy. I'm Director of Human Services for the town of Nantucket, and I'm in charge of some behavioral health responses that were initiated after the cluster incident earlier this year. We There were somewhere between 5 and 7 agencies involved in the postvention around that. So there's been quite a bit of direct interventions on people directly related to that particular incident, and several other tiers down the epidemiological ladder. But I've been put in charge of a community health response to this. Behavioral health crises, in this case, specifically a suicide cluster, which occurred in June. These, on a public health response level, there are very few interventions that operate on a population level. The one intervention that there is substantial literature suggesting has population level impacts is something called gatekeeper training, or GKT. GKT is a signs of suicide or a behavioral health or mental health first aid system. The most commonly used one is called QPR, a question, persuade, and refer. That particular acronym was designed to evoke CPR as a sort of metaphor for what it is intended for. I have a few papers, a couple of meta papers, and then one specific 3,000 person study on a population level, showing that there are significant increases in a number of resiliency indexes when there are widespread gatekeeper trainings available. So our response over the summer was to contact several different organizations who offer gatekeeper trainings, and then plan to offer those on an ongoing basis and different areas around town. Gatekeeper training, specifically the QPR model, was used by several different organizations on the island. There are several trained trainers, and then there are a variety of organizations from off island whose mission is to provide gatekeeper training. So as of now, we are launching initially to our house to target the youth demographic, and then internally for town employees, because those are easy for us to set up internally. And then we plan on expanding these gatekeeper trainings out to anyone who interacts with people who are likely to run into people in behavioral health crises. We've reached out to the Interfaith Council. We've spoken to different people in the schools. We're trying to determine some Spanish and Portuguese language instructors for these, so that we'll be able to bring this training to clergy, to people who work in human service areas. And then the intent and the addition to previous approaches is both the systemic approach to it, trying to offer it on a regular basis across different demographics, bringing it to people, and then adjusting the program so that it will fit the needs of the individuals who are taking it, and then specifically to connect them to human service or behavioral health providers, so that when someone notices someone's in trouble, there is a very smooth on-ramp into getting them into intervention or therapy or treatment if necessary. The idea is to sort of build out a behavioral health core of not first responders in the traditional sense, but people who have this training, and then tied into an awareness campaign where people can identify themselves as having taken this training, and then they are going to be out through the population so that they're identified in a similar way to, I believe it's the paperclip project, which was people will wear a paperclip that will identify them as someone who is trained in certain areas and can provide assistance to people who know. So as of right now, we have three scheduled PPR classes for this month. We intend to roll out at least 2 or 3 more next month. There is a series of grief counseling and survival panels that are being planned in concert with the Department of Mental Health, as well as Fairwind's 2 organizations on the Cape, the NAN Project and Sharing Kindness. And then we are also, through the Youth Behavioral Health Grant, offering there a couple of submissions along these lines, which are going to produce locally sourced trainers. One of the big issues here is that trainers having to come to and from islands sometimes will miss local cultural elements of it. So the idea here is to build up a body of people who are trained and people who have local knowledge as well as our trusted members of the community, both to offer the training to them and to offer the trainers training so that they can then disseminate that information as necessary. That's the high level response or high level description of our response. If there's any questions on that, I'm happy to answer them now.
Sounds great.
Yeah, I mean, the idea and I think this has been offered by Fairwinds in the past, it's been provided to human services, but it hasn't been a cohesive response across multiple different agencies. And we're hoping to get some collaborative grant writing done so that there are collective organizations that distribute the responsibility and we don't lose all the momentum on these projects if we lose a single member of the team doing it, which is so often happens.
Agencies have been responsive. I mean, in terms of, it could be, but you know, has that been
the response? I've been working on behavioral health issues here, and I have had more interactions in the last 6 to 7 months with the Department of Mental Health than I had in previous 2 years. There's been a significant change in how they approach this, and I think there's been more flexibility on the state level. Julian Sear passed through several behavioral health related bills, provided additional funding to those agencies. We've seen a lot of different agencies, both on and off island, starting to partner up. And then there has been a lot of work on Nantucket's behavioral health community with a lot of collaborative efforts that came out of the Behavioral Health Initiative, which, if you may or may not remember, a few years ago, a consultancy organization did a gaps study of behavioral health system on the island. As a result of that study, there's a collaborative effort across Fairwinds, the town, the hospital, several other agencies, NAMI, basically everyone who's in there, getting together and sort of breaking down the silo walls a little bit so that there's a little more collaborative effort, there's oversight, systems redesign, and then that has gone up into a new grant writing and grant seeking organization to help with collaborative efforts on these kind of behavioral health issues.
So my concern always with mental health on this island has been, I see a lot of organizations in it, and so the coordination, are you repeating each other's, siloing each other, walking on each other's feet? You know, we should,
I think it's a lot less than it was.
yeah.
Even in the 3 years I've been in this position, I've seen a noted change in the people who are appearing on the regular meetings and the people who are, collaborating. There are now mechanisms by which different organizations can collaboratively apply for funding. So there isn't quite the I've got to get my funding to keep my organization going. And it's been significant improvement, at least in my terms, for communication across agencies. We have done just much better just in the last 6 to 9 months.
in terms of the grant, I guess yesterday or today, whatever that, the behavioral youth.
Youth behavioral health
So,
grant.
what was the kind of response that, the town received that RFP?
We have the request for proposal period closed yesterday. We have 9, I believe it's 9 applicants for a total of $574. We have everything from a coordinated cross-agency grant application from Fairwinds, Our House, NAMI, and ASAP to a Horses for Mental Health encounter group. The idea behind that grant was to get people who had not applied for town grants, or people who had programs that they weren't sure were going to get through the normal contract review process. And so we have really kind of, I'm relieved that we got a sufficient number of applications, and there are some really interesting programs. That one is behavioral health in the wider scale. There's a big emphasis on wellness, community building, and collaborative work across agencies. But yeah, no, that was a very good response.
And with the review and stuff, that'll be, I know everyone's kind of waiting to know, so that they're able to start with the funding cycle.
Yeah, so the nice thing about the youth behavioral health grant is that money is immediately available this fiscal year. So that should be going to programming that will happen, if not this school semester, then next school semester. There will be programming that is funded this year. directly now so that we can, it's also being done in collaboration with the needs assessment through the Worcester Polytechnical Institute, where we're trying to baseline behavioral health information in a way that we can iterate and track what's happening with these studies so that we have a foundation of information that we can work on. And just kind of trying to data drive the way we do these interventions.
Anything else? Thank you. Good work.
Thank you very much.
Keep it up.
COVID clinics?
Oh, excellent. Sorry. My other hat.
Thought you were gonna get.
I
away.
almost ran away. The COVID clinics, so the September 23rd clinic that was scheduled for this week, we had set it up with the ambulance company that had been doing them for us for a while. Unfortunately, we scheduled it right in the window when the FDA approved the new formulation and withdrew authorization for the previous bivalent. So and I know this sounds like the dog ate my homework, we signed up a little too early. That clinic has been rescheduled for October 14th. If you did not receive direct confirmation from the color scheduling, and this is to the people at home as much as everyone else, if you did not receive direct confirmation that your appointment had been transferred, which most likely you did not, please sign up again on the 14th. We then have two more clinics immediately scheduled with the capacity to add more should we pass certain thresholds. But the federal policy on the financial side of providing the vaccine has radically changed, which means that supplies are significantly more constrained than they have been in the previous 3 years, and that it will be more difficult likely this summer or this winter, this fall and winter to find a dose because they now must be reimbursed through a different method. To the best of my knowledge right now, no individual will ever be charged at point of service outside of a private administration via a pharmacy. It will be charged to insurance with no copay and no point of service cost. The full schedule and sign up is at nantucket-ma.gov/COVID. There is a purple box in the middle of the page with a sign up link that will take you to these scheduling COVID clinics. All clinics will take place at the elementary school cafeteria between 9 and 2. It will always be on a Sunday. We have always be on a Saturday. Carrie has been volunteering at these clinics for 2.5 years now, so he knows the details, the time details, at least as well as I do. But the clinics will be held 9 to 2 Saturday at the elementary school cafeteria, and they will be sign up only to the best of my knowledge. Assuming we pass certain thresholds established by the state, we will be able to schedule additional clinics, but I would anticipate that by December, we will not have any more scheduled clinics, and the state program under which we are doing this administration is potentially ending in February. So I do not know if we will get additional vaccine clinics after December. Any questions on the COVID
And
clinic?
just remind the public, there's still the need for flu shots.
Yes, flu shots, we were actually looking into getting this organization to do flu shots at the same time, so you get a 1-2 brought down. The state has yet to confirm that as being a possibility, although I do believe the policy was adopted or recommended for adoption by the rural health. What's the rural health office of the Department of Public Health?
The application for the appointment does ask if you want flu, COVID.
Then they have added that on.
Yeah, I mean, there was that option. You indicate what you were coming in for.
Okay, then that they did finally get that up on.
I would
color,
double
so
check it,
thank you
but
very
I would double check it though. Yeah, that's just a computer my screen.
I would recommend everyone who is at risk get both an updated COVID shot and a flu shot this year. It is probably going to be another bad respiratory season.
And though the new RSV shot is available, we don't have it yet.
Yeah.
We are going to be looking into it as well.
Okay.
Thank you,
very much.
Jericho.
Thank you.
Have a nice day.
35 South Cambridge Street septic loan application.
So actually, for the interest of time,
Yeah.
the
Put
septic
them all
loan,
together.
I feel like we can put all the loan applications together, including the release for 22 Hawthorne Lane as well.
So let
Because
me,
we have no objection to them and it's just. for
okay,
the
so
loans.
we have 35 South Cambridge, 305 Matticat Road, 326 Milestone Road, 8 F Street septic loan.
And then that's it on the agenda. And then one thing that came in after the agenda was posted, but it is in the packet. For some reason, it's not showing. Because when we updated the
Yeah,
packet,
and
you'll
what-
see that
what's
it
the
got
address
cut
of
off.
that?
22 Hawthorne Lane.
22
as
in
well.
Hawthorne Pay
Yeah.
for the
So-
record. So
We have
do
no
I,
objection.
the staff has no objection. Do I hear a motion to approve those loans?
So moved.
Second, yeah.
Any further discussion?
I think the question, I know one of the items to discuss is the
the
changing
policy.
loan application. Are they, I'm assuming these are under the old rules because of
This-
one of the questions, the issues about resident or not resident.
Correct. This is
So-
under the old rules. We wouldn't be able to.
Right, yeah, back to.
Exactly.
Okay. Just wanted to get that out there.
These are the old rules.
Yeah.
Okay, all in favor?
Aye.
Chairman says aye. The applications are all approved. 41 Tennessee Avenue septic setbacks.
Yes, and I believe that. I believe Don is here as well. This is the septic
There he
setback
is.
for 41 in the Southside Road. You're right after. Right after this.
You're
Yeah,
next.
Right after.
You've been extremely patient,
Um,
but it's nice to have an audience anyway.
So 41 Tennessee Avenue, that is the, let me see, there's setbacks for the soil absorption system on this one. It's a very tight lot,
Right.
so this is the best place to be put, but it requires a decision from the Board of Health. We have no objection to this, but Don, if you would like
It's one
to,
of those no alternative,
there's no other alternative.
no other
Exactly.
alternative.
Yeah, I would just add, it's a upgrade to replace an existing field system that's too close to the groundwater, doesn't meet the 6-foot separation. And the reason we're asking for the variances to the lot lines is in order to achieve 150-foot separation between a couple of wells that are still in that neighborhood. And that's pretty much it. Thank you.
Any questions?
Did the abutters respond? There was a concern I had that they were given
That's
a
right.
wrong date, wrong location and wrong time.
Yeah, it
for
was given the
meeting.
wrong, it was, on the letters, it was given the wrong time, but it is, we usually get notifications ahead of time. We have heard nothing from any of these applications. If there was some objections, especially in Matticat, we usually hear from neighbors about that. But yeah, we haven't heard anything to object.
Any other questions, discussion from the board? Do I hear a motion?
Motion. Second.
Any further discussion? All in favor of granting the waiver? Say aye.
Aye.
Chairman says aye. Waivers granted.
Thank you. Good night.
108 Surfside.
I say we should probably just skip it, table this for next. month.
Yeah. Yeah, let's
Mr.
put it on-
Connolly, if you would like to.
We can put it on next week if you, or next month.
Yeah.
Just woke up, right? No.
So this is a nitrogen credit for 105 Surfside Road.
Anyone wants to see this?
We specifically had a stipulation here about the new lot being 40,000 square feet. Mr. Connolly did bring this to the meeting. We'll have it for the record.
From the registry of deeds.
Straight from the registry of deeds.
So when I put on September 14th, when the application was due, I went online to the registry of deeds and they said it wasn't available, so I waited till today to get the plan. And I gave Mr. Hedden at the Board of Health, the deed of the lot 2.
Yeah.
Because they deeded it out, so it's Everything's good.
And for the record, Michael Connolly here.
Yeah, oh, Michael Conley,
Yes.
thank you.
So with this in hand.
does this stuff back with you?
No, we have it.
That's ours. That's ours.
We put this for the file, we have to scan it in. With this in hand now, we have no issue.
Any other questions from the board?
None.
Do we hear a motion?
Motion to accept the motion as it stands. I guess the question
Wait a second, what is the
there
motion?
anything we gotta do? I mean, if it qualifies under the current regulation, that was the question.
The
wasn't it?
only issue is that it's in the well protection,
Exactly.
so you had to go through the Board of Health variance to get the nitrogen reduction.
Mhm.
And so that's why I'm here today.
But that was that note about 40,000 square foot.
Yeah,
Seems that.
in the packet, I took, when I did the plan, I took the area out, and then I just put a 8x11 photo of it.
Yeah.
And so they didn't see the 40,000. That was my error. But I knew it was all set, so.
Any further discussion? We had a motion in a second?
Yeah.
Okay, all in favor?
Aye.
Chairman says aye.
Great.
This is reverted.
Thank you.
And thanks for being so patient with us.
Policy discussion on septic system loans.
Yes, so with the loans that were brought in now, that we have in place, this is the one we were discussing earlier as old rules. We had to issue the loans as long as they provided the information requested. Now that we have requested the new $2 million from the state revolving fund.
Right.
And we had a new vote on the town meeting this last year. We finally got the funding put in. The new fiscal year started. What we're looking to do is change the way we've issued the loans before. So there's a new application in the packet that we had sent out, which asks a couple more questions of whether I've gone from 3 estimates down to 2, but also what we're looking to do is also require that you go with the lowest estimate, which is something we haven't done before.
Go with the lowest
The
estimate.
lowest bidder,
Oh,
because
okay.
what we've been just seeing is creep. And requiring the lowest bidder will create a level of competition that might stabilize some of the funding right now. And
Okay.
then the second issue that we were seeing is the loan was created, the spirit of the loan program is created to benefit year-round residents and year-round communities. What we've been seeing is creep of this going for second homes.
Right.
So what we're looking from the board is 2 votes, is 1 to vote in the new application as you see it, and then 2 to prioritize the loans for primary residents, and that the loans that are for secondary residences be capped at a certain percentage. That percentage is up to the board. Our recommendation from staff was that it be 50%. But it's up to the board.
Can we do this legally?
Yes, the policy is definitely our own.
Right, I mean, there's discrimination between second homes and, right?
The original vote as it was put in, I can definitely get an opinion from town council. And we can also put this on for next month with an opinion from town council. Our understanding was that we are allowed to do that based on what they do in Barnstable County.
I would
they have
just,
the same-
I would just feel more comfortable. with
Okay.
Town council.
And
Definitely.
you talk about prioritizing, I mean, it's first come, first serve.
It is definitely.
Is there a way to kind of juggle how we brought, that part of it is timing, so, but the other is there a way to juggle so that, or again, is it illegal to prioritize residents, even in terms of consideration over secondary residents?
We can definitely designate specific meetings as the loan meetings. So for example, we would only vote on the septic loans at the December meeting, the March meeting, and the June meeting or something like that. And have them bundled in order to be able to set up a better prioritization process. So we can definitely look into that as well.
Yeah, I would,
Well,
And could that be cleared by town council?
what
too?
happens if the second dwelling is for a year-round person?
If it's not their primary residence.
I also think if it's not someone's primary residence, the likelihood is, if we've all driven around in February, the likelihood is that house is not being used as much. And so there's not as much wear and tear on the septic system as there is on someone who is here all year round using their septic. system.
Yes.
So I do think that it is fair to do that, because I think this program, the spirit of this program was for people who are here year round and have.
I agree. I think I like the new potential priorities and regulations. Just want to make sure it's legal.
And we have like people who it's not their primary residence pay a higher tax rate. There's all sorts.
Yes, we have that, but that's done by legislation and
But I feel like that comes up a lot, but I feel like there's also so many ways that
I would just,
there are benefits
I
if
would
you're
just-
here year round.
Lisa, the changes we've talked about, can they be run by town council?
Yeah,
So
absolutely.
that we really
Can we
just.
vote on the application?
we can vote on
Yeah,
the
I
application.
don't see a problem.
We could also vote on the others pending approval by town council.
Okay, let's do that. That'll make it easy.
That'll make it easy.
So-
We're gonna have to
Vote to approve the new application and,
go one at a time.
We do need to, yeah, because we
Okay.
still haven't set a percentage.
okay, so vote to approve the new application,
Application,
motion to approve the new application.
application. Do I hear a second?
Second.
All in favor?
Aye.
Chairman says aye. Now we need a percentage and a motion, and the motion should include pending review by town council.
Okay, a motion to.
What
approve.
is the percentage of a year for a year round rest? They can.
We can cover up to 100%.
Okay, okay. Wasn't sure.
So
The current applications are 100%, no matter what.
Yeah,
To
So you
approve,
could borrow 100% of the cost of the
Yes.
the septic?
Yeah.
Oh,
It is a great deal.
Do we have to change the one that we have right now from, or can we just add into it that if it's not if it's secondary dwelling, we're only gonna approve 50%, or do we have to do the whole thing over again?
You can just add it. It's really 6 of one, half dozen of the other. But you can do the both ways.
Okay,
Yeah, I think
just
one
wanna
of the
make
quick-
sure we're doing it right. That's all.
Yeah,
One other quick note is just the income level change from the old application, went from 150,000 to 250,000. So just,
That mirrors the Barnstable County
That's-
one as well.
yeah, that, a big change that.
Well, wait a minute, I got one more question before we do this.
Yes.
If it's a secondary dwelling,
Correct.
right? Oh, they would have to figure, okay, for 100%, we're automatically just say we're gonna do math.
And we'll do that. Exactly.
Yeah. I think it's a great thing. I just.
so can I make a motion to approve a
Yeah,
change?
we're comfortable 50%, right?
I think we're hearing 50% is what people are.
Okay.
Or we could make it 49 or 51.
Just say no more than 50% of the.
So motion to approve changing the qualifications to people who, if the secondary dwelling, they can only apply for up to 50% of the cost of the septic, pending approval by town council.
Great motion. Do I hear a second?
Second.
Yeah,
All in favor?
Aye.
I vote aye. It approves.
okay.
All right.
Well, regulation public hearing.
All right. So we have to reopen the public. hearing.
Yes, the public hearing is actually still open. It's actually still open.
So that's true.
That's still true. So we will continue the public hearing on well regulations. You all received a copy. Somehow I received two. Or it may have been just my printer. I don't know.
I think we did send it twice. We sent you one.
Yeah.
Yeah, but when I printed it from the packet, I got two of them.
I think that's because in the packet we had to upload the
Whatever, it doesn't
the
matter.
changes, the
Okay,
updates.
so anyone from the public wish to comment?
We worked closely with Jeff, Mr. Blackwell, if you have anything to add while we're here.
Come on up and sit down, and Emily, you want to come, or?
Paul?
Oh,
Yeah. Well, you guys
Right
get
in
at the table.
part of the.
See, I like this better than the big room.
You can see me sweating. Well, first of all, I'd like to thank Roberto and John and Michael and the health department for open exchange of ideas and they're very accepting of comments. I'm sure some of my comments are off base, but they will at least listen. And I think the draft that you have before you today is much improved from the July meeting. And I think there's maybe some more housekeeping and I won't speak for Paul or Emily, of course. But I think it's come a long way and it's a better draft and we do continue to be involved.
Was there anything that stood out, whether you got a committee, I really do appreciate it. So is there anything that stands out as like either a point that's going to cause a lot of, kind of have people have to come back for variances, because the existing, this regulation still isn't lining up with certain realities that we got to deal with, or is there anything that kind of hangs heavy over your head about it?
Not really. The current relief procedure for lots that pre-existed the last major change in 1990 has been brought back into this draft, which I think is allows the health department staff to do what they've done for 33 years, which is read the regulation, apply the regulation, and make common sense interpretations without having this board inundated every month with variance requests that the original drafters of the 1990 regulations, they worked with the land council and they worked with town council, and there was an 11-member board that the Board of Health convened to advise, and I think it made for a workable and reasonable regulation that you've been operating under for 33 years, and in the new changes and improvements to the well regulations are environmentally, much better. It recognizes state-of-the-art science and testing and some of the unfortunate chemicals that are in the environment now that require protection of the public through your regulations. So I forgot the question, but I just started talking.
That was a good answer.
Hey, long enough that we forgot the question too.
Right. I am going to leave you, and we'll continue the meeting. Let the record show, and I thank you all three particularly for your input in this.
Thank you, Malcolm.
Good to see you. Thank you. Good to see you.
Keeping on for the wires down here.
Oh, thank you. So hello, again, Emily Holden with the Nantucket Land and Water Council. I first of all just want to thank Roberto and the Board of Health for proposing a number of these changes. I think that incorporating the state's new standards around PFAS and forever chemicals is very responsible and important thing to do. I appreciate seeing that in here. I spent a little bit of time reviewing some of the changes and regs with Roberto, which was very helpful for me. Just some of the questions I had around the water quality testing requirements, say when a property transfers and how that would ultimately be enforced. And he talked to me about looking back, doing an annual census to try to make sure that all those transfers are captured and reviewed. And then also just around looking down at section 11 and some of the pre-existing lots, and that just gave me a better understanding of what maximum feasible compliance looks like in different instances. So I appreciated the time that he spent reviewing a number of them with me as well.
And thank you. Paul Santos, Nantucket Surveyors. So you may not seen me or been before here. I had just a brief conversation with Roberto today, and I understand where it was a conscious effort not to grandfather lots after the 1990 date, like had been done previously, that this regulation, once adopted, will become effective. Jeff was instrumental in having that protection brought back in for the pre-1990 lots. And my only discussion was that once approved, I think the regulations all, like I said, they all make sense. I think it's all for the benefit. That once the regulations are adopted, then maybe a time frame of whether it's a few months or a few months, that way, anybody who got lost in the shuffle here didn't know about the change in the regulations, that the regulations are now been adopted, but now they become effective on a date specific. And then maybe someone now, once the word kind of gets out from the Board of Health and so forth, that the new regulations are out and they're adopted, if there's someone that was kind of left in the wayside there, they may have a month or two to see what effect it may have on their properties and deal with that before the effective date of the bylaw. And that was kind of it.
Will we be able to, I mean, I'm assuming it's based upon the date of the application for the well application. There's an interaction with the town to do something, whether it's a repair, drill a new one, replace.
Yeah.
So is there a defining a window that you're kind of in the queue, but
Exactly. So in the regulation, we have specifically section 17, there's an effective date portion. The effective date, we left it blank because it's a discussion I have happened with the board. However, the recommendation that we have is to make it effective January 1st. By doing January 1st, not only is it starting with this new year, it also comes into effect with the new short-term rental as well, but it also gives us time to people who have current applications pending through the planning and zoning board to be able to work through the process and be able to pull permits with us without having, forcing them to go back and pull permits again or update their subdivision plans. And
do we have a
things like
sense
that.
of how many are in there? I mean, because what we started seeing was because it seemed like we started talking, a lot of stuff started coming through, and because they
That
want to get
always
ahead of it. I know it always happens, but are we talking 5? Are we talking 100? I mean, big difference.
Usually what we see, what we were seeing when we saw the influx of new applications, when it comes to wells, it was only maybe an extra 1 or 2 a month. It's not a massive change, but it is enough that if you change the location or the requirements of a well, you can blow up an entire subdivision plan. And we would hate to do that to some people. Is really kind of the truth there.
Okay. Appreciate it.
That's why we were going to suggest effective date on January 1st, but it is always up to the board.
Yeah, no, that's 90 days. Is that?
I think it's fine. Yeah, because I think once everyone knows it's adopted, where it's gonna get.
Right, anyone's in.
More so, like, people aren't paying attention to kind of what happens here, but once they say there's a new, it gets published too.
It gets published and we also have to send it to the state register
Yeah.
at DEP. But the other unforeseen consequence on this as well is realtors. If they already have closings scheduled within these next 90 days and this regulation kicks in, we might blow up that closing as well. Because we're requiring certain tests.
Well,
Yeah.
no offense, but that's not my
These
concern.
things happen.
Yeah.
So do we close the public hearing and then vote on it?
If you're okay,
I was gonna ask, does anyone have anything else?
yeah.
Did you have a few suggestions, Jeff, that you thought should be incorporated? Or- Oh, you gave them to Roberto. That's
Yeah,
right.
there were
a couple in today that there were
three.
minute and.
Yeah, there were 3 specific suggestions. two of which we had actually done by design,
Oh.
which is why we left it in there. One of them, if you don't mind, I don't have it in front of me. Let me see which one it was. Yes, so when you said, recommend petroleum oil in section nine B, where we specifically ask, the description was, and then it says subsurface fuel storage tank.
Mhm.
Jeff recommended adding petroleum oil fuel storage tanks. We kind of did that by design. We want all fuels tanks,
Yeah, I mean,
looked at, including propane.
So you want propane?
Yeah,
Yeah,
including
I mean-
propane. I know propane is not necessarily a groundwater contaminant per se, but it helps us from a Board of Health perspective.
But
when it
also,
comes to
many of the
just
propane tanks are underground.
Not,
Majority of them are.
Yeah, so, I mean, that a contempt, but I mean, that if it leaks,
Yeah.
it's gonna go into the soil goes down to the
Yeah.
ground, so the water, so.
and then sufficient quantity of water, where it's on section 7, subsection 2. Jeff was asking about on the last sentence, a sufficient quality of water for the use of property to be served by the well. He was mentioning that we should define sufficient quantity. We actually already used the plumbing code's definition of sufficient quantity.
A certain rate per.
There is a certain rate, or it's a certain
Right.
I think
gallonage
it's
per
gallons
day.
per-
Yeah, gallons.
Yeah.
per minute, and over a certain amount of time, you have to
Yeah.
run clean and
You have to
full.
run it for a certain amount of time.
I was just thinking if it's incorporated into your regulation, then,
Yeah,
people don't have to search for,
on a separate code.
yeah.
Yeah, I mean, that should just be part of, if we know what
Mhm.
standard we're using, we should either, you make an absolute reference or say this is the number.
Okay, all of our regulations refer back to our definition regulation. We have a definition regulation, through the health department, through the Board of Health. We can define that.
Actually,
well.
in definitions in the glossary for this, can it be defined?
We also have an overarching health department, Board of
Okay.
Health definition,
Okay.
so we can add that there. And then, there is the third suggestion was definitely a legitimate suggestion in section 7 as well. First sentence of paragraph 1, where it says prior to issuance of a well construction permit, and again, prior to issuance of a certificate, they need to provide a pumping test report. You can't provide a report prior to the installation. So you said we should strike that, and that I agree with. So that's why I definitely said 2. 2 we were by design, 1 was not. So I would definitely suggest accepting this one suggestion here. And I think those were the only 3 last minute ones, correct?
Yeah, just a general, concern is, with Kathy LaFave retiring, you lost a great resource, a person that
Oh,
had
yeah.
a lot of experience and, I don't know how you replace somebody like that quickly, because experience
You can't.
comes slowly. The additional layer of review, which is, after the well is installed and the pump test takes place and the water quality, is sent away for. And then all that information is gathered together and submitted again. The way this regulation is written, and I don't think it's unreasonable in the big picture, is that all those post-installation quantities are then submitted. There's another review before someone can actually obtain a building permit. So with, your heavy workload and loss of a staff person, I mean, we're seeing something like a month for a review of like a septic system design or a well permit application. My concern is that review process becomes 2 months. Then in effect, well, even more than that, because you have the original review and issuance, and then the well goes in on some schedule, and then there's another review period before the well or a building permit can be issued. I don't know if there's a way to just create a form and a streamline so that perhaps it's like checking off the boxes when you receive the pump test, the water quality test,
We could definitely.
so that maybe doesn't take another whole month.
Absolutely, that's
Um,
that's an internal policy thing. We can definitely set that up for efficiency.
Just the thought.
And
So how much-
technology have
How
any
much
benefit?
time do we talk about
Exactly.
from when the well is driven till everything, and that thing gets approved? A month?
Well, I don't know, I don't know how long the water quality test will take to come back. The pump test will be known at the date of installation, so, I'm not really concerned about that time to gather the information, receive the test results. It's just, maybe there's a way to streamline a little bit the
Our
final review.
Our final
in-house.
processes, so
Yeah.
if it's good, it's not waiting about to sit there and say the obvious.
Right, it's almost
approved.
an administrative person who's checking boxes.
You know, and maybe there's some way that we can, I mean, and I don't know where we are, I don't know how the technology for the town works, but. That is there some, you know, there might be some way to, we can look at other places, is there a way that stuff is reported in and verified? And kind of like almost taken in some, are there places where we can remove the human having to handle quality information and also organize what we do better?
Yeah, there are definitely things that we can use in our current software to add this. And then there is a separate module, a permitting module that our software we can purchase. I'll need to talk to IT for that. But through that module process, we definitely can add these sorts of checklists.
I mean, it's something that, yeah,
So-
you know, we can only do, so we can't control what happens on the outside, but we can, if we can improve our internal, so that if everything's okay, or if not okay, we can respond to it and.
Mhm.
You know, go forward or have people know they gotta make changes.
Mhm.
So I'm not sure if that's part of the regulation or is that just more of
That's
an
an
internal
that's an
kind of.
internal policy.
Yeah, I
so
don't see that showing up in your regulations.
That's a policy side.
Anyone, anything else? Want to close the public hearing?
You can do it by consensus.
Or do I just take a, ask for a vote?
Yeah, and then
Oh.
if there's any further
I thought there was a
discussion.
motion to close.
No, you don't have, you as the chair are allowed to close it.
Okay,
If you want.
then let's close the public hearing. And are we taking a motion to adopt or not adopt these all regulations?
With the changes,
The one change to section 7.
and that is a removing of the pumping test report.
Correct.
Yeah, so with that,
Yep, just all in favor?
Aye.
Aye.
So do we check this?
We also need to vote on the effective date.
Oh, yeah,
Okay.
January 1,
Is
that was
January
what
1
you
okay?
suggested,
it's
right?
not, well, 90 days from now, it's
I,
really close to January 1. I mean, it's December
Yeah.
21st. So we can make January 1, it's clean. And
Yeah,
Okay,
okay,
am I making the motion?
to make it January 1st,
second.
2024.
Second, okay.
All in favor?
Aye.
Aye.
Okay.
Thank you.
Okay,
All
thanks.
right,
Adam.
thank you.
So you'll
All right.
check
All
that.
right.
I'll retype that
And
up.
we
I'll
need
get
to
you-
adjourn.
I'll get everyone a clean version.
Aye.
Get that up.
To adjourn?
Motion to adjourn?
I'll second it.
Yeah, we're
So
out
you
the
guys
door,
still need to vote.
A motion to adjourn?
I think we made the
They made
motion.
the motion,
Yes.
second, all in favor? Aye.
All right.
Goody.
Adjourn.
All right, and the next meeting is Thursday, October
19th,
19th,
I
Yes.
believe. I am not going to be here.
which is, yeah.
Oh, you're not, I have some thought. Can I write them down to be sent in?
Before we do, I do need to close the.
Yeah, we gotta.
Oh, no,